To prepare well for future emergencies, we need to develop the right capacities across the world, particularly in countries with weaker systems. We also need to ensure that we have the right tools for early detection and for quick response. As at Africa CDC, we are convinced that this requires a new way of doing things. We call it the new public health order, which has 5 different pillars. The first is to strengthen the capacity of public health workforce, meaning we train the right experts, we give them the right tools, and then we deploy them to areas where they are required to do their work. The training needs to be adapted to the different parts of the world because different regions have different needs and they also have different burdens of health emergencies. The second pillar is strengthening of health institutions. We must strengthen institutions so that they are able to do the planning during peace times and they are able to do the response during health emergencies. These institutions must be national, subnational where required, continental and global. For us in Africa, at the continental level, it is Africa CDC, the Africa Medicines Agencies are the key institutions that need to be strengthened. The third pillar is local manufacturing. To be able to prepare well and respond, it means that all medical countermeasures must be accessible quickly when needed. That is why we are advocating that each and every region should be able to manufacture its own countermeasures, and during huge outbreaks, then the other regions can support a region that may not have enough manufacturing capacity. The fourth is domestic resources. We are convinced that when resources are available locally, then response can be able to be done faster and more efficiently based on local priorities. The fifth pillar is partnerships. We know that our advocacy is around Africa doing things on its own, but we don't have to do it alone. We need partnerships so that we do not reinvent the wheel, but the partnerships that we are developing must be based on 2 characteristics. The first is priorities for Africa, and the second is action-oriented partnerships that actually give results and therefore are designed to end outbreaks and health emergencies. These are the 5 things that we need to do to be better prepared for the next outbreak and other pandemic.